and November 15th as written. But it wasn't November 15th, it was November 5th, right?
Yep.
The first Thursday.
Oh, yes.
I'm catching up to Kevin.
He sets a high
High
bar.
bar there, Rick. Yep, high bar.
Any other adjustments to this or amendments?
I know that we're working in collaboration with the school system right now with Mary Juliana and Sharon Grotto. And we've established that currently in the school system, I should say total in the school system, there are 35 cases of students and teachers combined. Right now, there are only 5 open active cases. 2 are teachers and the remaining 3 are students. With regards to private school, Austin Prep is 1 active case that is affiliated with basketball. We've obtained a roster for the boys basketball high school 9th grade list, and we're currently doing contact tracing. We're assisting with that. I believe the total number of cases for Austin Prep total to date are 19, but again, just 1 active. There are a couple of clusters or potential clusters that we are either currently performing contact tracing on, and that would be Reading Baptist Daycare, which is currently closed for 14 days. They are getting professional cleaners in there, and there is 1 active case. With regards to Cafe Capri, they are currently closed. There is 1 cook that is positive, and the remainder of the employees are being traced and preparing to be tested later this week. And I received a call from John Douglas Funeral, and there was a potential positive case, and we're currently doing some contact tracing right now. There's only 1 case to report. Again, like I was mentioning, yeah, sure, I'm sorry, go ahead.
Can I just ask right at the beginning of your comments, how many currently in terms of active cases in Reading overall, did I see 83 as a number, or is it, what are the number of actual active cases as of today?
No, you're right. So you did see that, and then we had acknowledged a couple of more that came in through Maven later on. So we just did not have enough time. You know, I believe that the data reflected. You know, you'll probably see that tomorrow. But so I had to actually add it myself.
Okay.
So those were cases that came in later in the day or after 5 o'clock.
Mm-hmm.
Okay.
I also heard a rumor that Christopher's is closed again.
So, yes, I was informed that there was a case there. The owner chose to close, and to be honest with you, I don't have any further information on that. I'm not sure if he's having his employees tested. My guess is yes, but I did send an email with guidance out and asked the owner to call.
Okay. He posted it on Facebook. That's the only reason I know.
Wow.
Yeah.
If I could also too just mention, we are aware of 2 positive cases at the DPW. I've been in, discussion with management there as well. And also there is 1 positive case at Artist Senior Living, and staff and residents are currently undergoing mobile testing. So the nurse director at Artist Senior was able to get mobile testing for the residents there.
Great.
Town hall cases,
I mean, not
Christine.
great, sorry, great that they access the mobile testing, obviously not great that there's a case. Great that they were able to move quickly on that.
I would say that over the past 3 days, again, like we have seen a significant increase in the number of cases. I know yesterday alone there were 13, and I would say they're averaging 6 to 10 over the past 3 days. The amount of cases that are coming through, that is definitely higher than it has been. We are still currently in the yellow, but if we continue on with the amount of cases per day, we'll be moving into the red.
And Christine, with those numbers, those aren't numbers that would necessarily be attributed to Thanksgiving activities, right? Those would be a little bit earlier in the calendar, correct?
Yes, yes, correct. That's correct. About 2 days prior to, I'm sorry, 2 weeks prior to.
Yeah. So we won't know about Thanksgiving impact really until more like December 10th.
Yes, correct.
Okay. Thank you.
These items 5 and 6, as we know from talking about it last week, last meeting, do kind of run into one another. But unless Christine has something really compelling to say, I want to point out that she gets an awful lot of calls, just points of clarification. There's been a couple of others from the town hall that weren't DPW cases. Christine?
Yes.
And folks that come to our website have questions that, I try to answer, but she has, better answers. So we just dish them off to Christine. She's bunting things back besides just doing the contact tracing. Her job has, really picked up in the last few weeks. People, I think, in the community, are even more importantly, people, our colleagues in town government understand that we have somebody with these skills,
right,
and things are funneling to her rapidly, and we got to watch out, make sure she stays ahead of it.
Mary?
May I ask a couple of questions, Christine, kind of in the same vein of what Peter was raising?
Sure.
I actually had a couple of interesting conversations in the last week about whether you could be exposed to COVID, whether you're at risk for COVID if someone were breathing on your food. And I know COVID's not foodborne, but I wanted to take an opportunity to hear from our nurse about that. Do you have any info you want to share with us or could share with us?
Sure. Okay. So when we talk about food, there's never a zero risk situation. Although, based on our current understanding of COVID-19, there is no evidence that there can be any transmission of the virus through food. And for example, that's if someone who has the virus is cooking and coughs on the food, and then you go and ingest that food, what happens to the virus? The virus, it's non-transferable. Again, this is what we know about the COVID virus, and it's transmitted through respiratory droplets.
Yeah.
So it would really need to get into your respiratory tract to cause infection.
Yeah.
I would say that if someone has COVID and coughs on packaging, I guess it's a low risk, but there's the potential for someone, to touch the contact and then their mucous membranes, and the person can contract it that way. Yep. Through the respiratory tract. I know it can live on plastic for a couple of days and cardboard for 24 hours, but again, I believe the studies to date show that that's a very low risk.
Right.
I hope that answers the question.
Yeah, that's very helpful. Thank you. Am I frozen?
Yes.
Yeah. No, good. I didn't know if it was my machine or not.
I think so. I'm moving, but look, there's my friend Chichi. So if you could hear me, what I'll say, Christine, is that it sounds like someone breathing on your food is a food safety risk. It is not
Right.
as likely a COVID risk. Is that
That's
fair?
That's correct. That's correct.
And there's a buzzword, a phrase
Thank you.
surrounding
Okay.
things
Thanks.
at this stage of the game, and lots of issues with public health have data gaps. And if you can just think in terms of data gaps, we don't know everything about everything. So these aren't bad questions. I prefer to try to avoid them. If possible, if somebody wants it, we have the straight answer as best we can. But I like to say, there's all kinds of data gaps. We're not going to find out tomorrow that, food can actually be a vehicle to transfer it. And then we look, a little bit behind the 8 ball on this. And every once in a while, I'll go on one of my little diatribe
A
things.
little bit for me. I don't know if
Can't hear you, Phil, Carrie.
Harry, your video is frozen, and your voice is a little bit.
right. I'm gonna sorry, let me, yeah, Zoom is stuck.
Well, I don't know what you need to do, but save your thoughts and we can return to them. But all these what ifs don't add up where I come from. And so it's fine to pose the questions, but I keep it simple. And there's all kinds of data gaps at the present time. We don't think this or that. And that's I think what Christine was getting at too.
My understanding, Peter, is that if you ingest food that has the virus on it, the stomach acids render it inactive.
Might be.
Mhm.
I was surprised when I first heard the two samples at Deer Island and looking for virus loads
Virus.
coming through the wastewater.
Yeah, but it's dead virus.
Right, dead virus.
It is.
Yeah, actually, what I've read is that those early studies done where they looked at how long the virus lasts on various surfaces like cardboard or plastic or whatever, and they found that it was like 24, 48 hours for some, or 72 hours. They really apparently did a heavy viral load on these surfaces, and then they were measuring the presence of the virus, which doesn't necessarily correlate with infectivity. Like the virus proteins and RNA could be present, but the virus has deteriorated to the point that it's not infective to humans. And so I think although we push a lot around surface cleaning, it's probably low yield comparative to masks and airborne transmission and so forth.
Yeah.
Not that we should stop it.
Right. No, it just reinforces what we need to be doing. So
Yeah.
one thing I wanted to ask Christine, actually two things. One is, with the increase in cases, have we resorted to using the state tracking system, or are we still doing it in-house?
We're still doing it in-house. We actually had a meeting this morning with the CTC, the nurses and myself, to sort of establish if the numbers do continue to go up, what we would then do. And so our thoughts right now are, if we need assistance with tracing just for contacts, we would utilize them, but we really do prefer to keep any active cases internal. And I believe that's manageable because we have a nurse that's on we have coverage 7 days a week right now, someone that's able to acknowledge the active cases that are coming through.
Okay. And have we moved to the new guidelines around quarantine that the CDC published a day or two ago, which is not 14, but 10 days or 7 days with the test?
Yeah.
Have we started to use those?
So yes, and I will say that there is some confusion around that and a lot of disagreement among some public health nurses. However, we are using it, and the updated guidance is that, just like you said, 14 days from date of last exposure, or if you are asymptomatic, at least 10 days, you are allowed to have a test on day 8 or after. It has to be a PCR, and that will permit you to actually exit quarantine a few days earlier. I'm actually working with the school nurse right now because there are a lot of students that are asymptomatic, and their parents are asking, if they provide proof of PCR test, can they either return to school or exit quarantine early? And according to the guidelines, yes, we have been, going over that. We would prefer to keep it the 14 days, but if it is applicable, then yes, we are discussing those the updated guidance.
Great, thank you.
Hi.
I just have
Great.
a couple of questions.
Welcome back.
Thank you.
A couple of questions I have just from a general standpoint. Are you seeing that most people are symptomatic, or are they asymptomatic?
I would say, and this is just a rough statistic, about 70% are symptomatic.
How severe?
Honestly, not as severe as in the beginning. Even those that are seeking treatment, whether it's a hospitalization, they might be inpatient for a day and then discharged the next or within 2 days. That includes people that have existing comorbidities, including cardiopulmonary disease, diabetes, people that might be immunocompromised, people that have lupus or RA. So we really are seeing people recover a lot quicker.
Okay, that's an interesting data point.
That's good news.
Yeah, that is good news. So the other question that I had, Christina, maybe you haven't heard this, has the state started to talk anything about CT values with the testing? Have you heard anything about that?
I can honestly say I have not,
Okay.
and I do try to get on every weekly webinar with the state, but I have not. I can certainly look into it.
No, I was just out of curiosity. I know you're probably not hearing about it because they're not really that reliable
Okay.
as of right now, but I think they're trying to work towards that. I bring it up as hopefully a tool for you to be able to utilize from a priority standpoint. If you do start to get a bunch of cases in, it'd be good to know the CT values of those cases to prioritize who is the most infectious cases coming before your desk. Again, it's not an exact science, so they don't really like it for that reason, because it's not 100% reliable. But I'm just curious to see if you were hearing anything on the state level.
Yes, if I can correct myself, and again, we had a meeting with the CTC. I do believe that they are just starting to utilize that. That is part of their protocol to sort of prioritize who the population that they need to, pay more attention to. But I'm sorry, I really can't comment beyond that.
That's okay. Thank you.
Sure.
Carrie, you had a question?
I wasn't here, so I don't know if I'm jumping in the line or sorry, I had to hop off for Zoom. So I came back in as Christine was finishing up talking about quarantine, and then I just had 2 other questions, quick ones, I think. So with the quarantine, are we saying that it's the new state standards of you can exit after testing at day 8 if you've been asymptomatic the whole time? Is that what the discussion was?
Yes, and
Yeah.
Thanks.
Christine said they move each other.
Yeah, thanks. Okay. And I know, but as I was crashing on my Zoom, I know we were talking about the sewage piece, and I know from having reviewed all these studies and talking to folks who are doing this, that that pieces of the virus are detectable in the sewage. It's not that the virus is active, it's that there are pieces that are detectable. So it is a valid measure of activity, that's all, but it's not an indication of that you can get the virus through foodborne methods or, yeah, okay.
Sure.
All right, and then my last question was just, Christine, can you clarify for us about the standard, the reason why it would be important for anybody who's tested to kind of self-isolate, self-quarantine until they get their test result?
Sure. So, so it has to do with the incubation period for the virus. It's thought to actually extend to 14 days with a median time of 4 to 5 days from exposure to symptom onset. So that's why when, let's just say, someone tests positive and someone's exposed, so it's a contact, they don't recommend that that contact run out on the second day and get tested, that they actually wait 4 to 5 days and then go get tested.
Right. And then even if you're testing, even if you're just testing for proactive reasons, not because you think that you actually have it, but you want to document that you don't have it. If you test and then go about your business as a like a regular person, is there still utility in the test result that you get 2 to 5 days later, or is that a problem?
Do you mean like an antigen versus PCR test, or I'm sorry?
No, I mean a PCR. So say I decided I wanted to travel, and so I got tested, and then I went and did my errands today, tomorrow, and I went to got a cup of coffee somewhere, and then I have a negative result when I get my test results 3 days later. But that negative result isn't really meaningful because I've continued to put myself at risk of exposure post-test, correct?
Oh, yes, exactly. Yep. Meaning, so you're still going out and you have that potential to still be exposed.
Yeah,
that's correct.
Okay, because I know there's been some confusion and people sort of saying, well, why do I have to, if I'm just getting tested because I'm trying to be a good doobie, why do I have to stay home? I know I'm not sick. But
yeah.
The test
yes.
is, okay, thank you.
The test is only as good in the time that you have the test. You can still contract after your testing if you're still going about your daily life. And I hope that helps answer.
Yes, thank you. It's so very common sense, but I think people get tangled up in kind of the testing and what you can do or not. So thank you.
Sure.
Any other questions for Christine?
Thank you, Christine.
Thank you.
Thank
You're
you.
welcome.
Thanks, Christine.
You're welcome.
Well, Christine, I mean, if it's with the chair here, we can continue talking about some staff report. We want to skip around and come back to that under number 9.
Well, do you have anything else with respect to either permit issues or any other COVID or any other issues not related to COVID that you'd want to report on?
Okay, yeah. Yes, I do.
Yeah.
And so, but let me start by pulling away from COVID with what you received a few hours ago, and that was an email I sent to the skating rink manager, and I hope it was taken in the air in which it was intended, and that is we wanted to share some information. I want to make it perfectly clear that these places that are borderline with all the data gaps that are there and with the changing policies as they are occurring, and with the lack of oversight from an agency, a government agency, a health division, we're counting on this responsibility being accepted by parents, schools, folks that are out there, as well as management of the businesses that are operating. And I don't mind the self-regulation part, as long as they're strictly aware, acutely aware, that we do the contact tracing, and what happens From those numbers, we'll determine what our next steps shall be. And so I relate this to what Christine was just talking about, and all the many questions and the what ifs and the scenarios, they just keep building. But if we discover that there are hockey players that are attending captain's practices at a skating rink, and then there is an outbreak, then we're going to do what we have to do, and I want to let that business, the only one that we have in town, aware of it, so that when we come in and say, you know, you're really going to have to take more drastic measures, and that's because of the contact tracing. That's the real data that's out there. That's the only thing we really can count on, those numbers that are proven positive. So I don't know if that makes sense. I'm not reading much body language back here through the Zoom meeting, but that's where I was coming from there. And that will sort of lead into another piece. Are there any comments on that before I lead into the next piece on skating?
No.
If not, I will say that, you know, we have been approached by the town this time, that the town's recreation department wants to open public skating rinks and outdoor ones. And so I'll just drop this off in the lap of the Board of Health here tonight and find out if, you know, based on what we know from Christine's report and, you know, what we know from Mirandy's sort of sentiments around that, how do you feel, just off from the hip, about public skating outdoors? And I'm pretty sure you might be interested in, you know, let's limit the number. Do we want to have skating guards? How do you want to regulate it in any way? I talked about it with Christine before we started and said, I could just come up with something with records and then notify the Board of Health. But I really think it should flow down from the board. And in case you know, have some thoughts.
I don't know how you'd regulate the numbers that show up at any given rink.
At a public skating rink outdoors.
Yeah, I don't know. How do you regulate that?
I mean, I can brainstorm with you. I can see somebody there from the rec department, maybe a part-time employee, taking, you know, filling in the same way we did for some of our other, you know, with our addendum for social activities. You know, sign in. I mean, they do it at Walmarts all over the place. There's a guy standing out front with a clicker. You can't get on the ice until one person's gotten off the ice, because we only have room on the ice for 30 people, based on length times width, whatever the area is.
Are there open air skating rinks in Reading?
Yes,
There's a couple of them.
Yeah, there,
yes.
Memorial
Several.
Park and at the Birch Meadow Complex has them.
And Sturgis, down
Sturgis have it too?
Yep.
Okay. What they do is they flood the runoff areas that they have over there.
Oh, okay, yes,
Yeah.
okay.
I mean, if you don't want to give this the thought, then I can and report back to you, but I'm not sure. I mean, one of the issues that we're dealing with, you get too much information from the staff level up. And I thought this might be just broad enough so I could get some information from the board level down and, you know, work it in. Or if you just like me to report back to you, you can take this under advisement as I go forward, and next time we meet, say, how far did we get with rec department since the last time we spoke? I guess, Paula.
I would,
So,
Oh,
sorry.
yeah, Richard,
Yeah,
me down. I'm not the chair.
just a couple thoughts. One is that, you know, there's this 20, it's, I think 25 limit for outdoor events. This is an outdoor event. So
Yeah.
there's no reason not to be consistent with that.
Okay.
And number one, and number two, unlike hockey, and particularly indoor hockey, and where it's a semi-enclosed area, you know, this outdoor skating, people aren't checking each other. They're not running into each other. And so they should be wearing masks, but I think it's a safer thing being outside. What I don't really understand, though, is unlike the Burbank rink, where there's a facility owner who has responsibility, if they flood parks and people show up, I don't know who's responsible. I mean, we could send out recommendations and, and try to educate the public so that parents know, that, having 50 kids on the ice may not be safe. But so those would be the couple things, the 25 and the masks. So Paula and then Carrie.
Yeah, so that was what I was going to bring up is oftentimes there's a lot of pickup hockey games at these rinks.
And they are checking
And they are checking.
Much for that.
Yep. So, I mean, that's going to be an issue unless we just put an all-out ban on hockey on the outdoor rinks. And I think we'll get an outcry from that, to be honest.
And how are you going to monitor it?
Right.
So, and if I may, I guess I'm thinking back to when we were doing this in the late spring, early summer, and we were talking about basketball, and we were talking about other pickup activities, and what we chose there was, and tennis, I think we chose signage and identifying what the kind of limitations were. So I think we probably want to be consistent in how we manage sports in the town. I wouldn't want to be singling one kind of sport out versus another. And I worry about the ability, will folks self-police, just like we did with basketball. We sent out the notices, but there were lots of instances of lots of basketball games happening. You do the best you can. It's the town's responsibility. The town floods the parks. The town provides the facilities, just like we do the basketball and the like. But we need people to self-police too, self-regulate. That was a little circuitous, but
well, I think the
my point.
idea of posting signage at these locations with the Board of Health recommendations is a good thing. But yeah, it's very difficult to think about how to police it. We just can't be there at all hours and so forth.
Yeah. I think the hours that you'd have to police would be from after school until, well, they have the lights on at Memorial Park and
Birch Meadow.
Yeah. So, I mean, that can go until the lights go off.
Well, another way to kind of consider this is and this is what our rec director did. She canvassed a couple of towns and how are they working it, and take a couple of lessons out of their playbook and see how it goes. If it feels like it's getting out of control, we can talk about it. I'm not big on bans. I don't think that's productive. It's hard then. Then you're looking for compliance levels. And I don't think we really want to get into that. But we may.
One point I would make is that, you're looking, this is a behavioral issue really more than anything else, right? So you are providing a mechanism for, obviously, I'm assuming it's going to be mostly kids and what have you to get together. They're getting together somewhere else. I don't know that this is going to be that kind of, okay, this is the one, this is what put it over the edge. But folks that aren't comfortable with it, they're simply not going to do it. So I hate to take, especially an outdoor venue away from a mental health standpoint, first and foremost, quite frankly. And I just don't think we're going to move the needle by pushing them in one direction. Anyways, they're getting together with their friends after school. Anyways, if anything, a lot of times they're getting together riding around and they don't have masks on there together with it. If we make them wear masks on there, if anything, what we've done is we've lessened their chances of them giving it to one another.
Right.
That'd be my thoughts on it.
Right.
There are a lot of examples of that.
Right.
You force things on the ground, it gets worse.
Yeah.
You just made me think. Somebody made me think. I mean, we could certainly, if there were results from contact tracing that indicated that this kind of activity was connected with any number of cases, that would be an indicator, and that's something that Christine and the other staff would be aware of and could notify if it was presenting a concern, right? And we could then respond differently if need be, just like with anything, right? Any other organization, a skating rink or a business or whatever. Right?
But we're not gonna be the only town that has one, and we'll be monitoring, you know, other communities that are doing this. We're not gonna wait for Reading to have an outbreak. If somebody
Right.
else does, then we can use that to flop onto our,
Right.
information.
So what I'm hearing in summary is that go for the outdoor skating with signage with Board of Health recommendations, limiting numbers, masks, and the like.
Yeah, I
We
think,
can work on that.
and then I think, it wouldn't be a bad idea for staff in the health department to, from time to time, drive by and
Well, check.
just take a look, if it seems like it's out of control, we could revisit it.
It could be
I agree.
rec department people too, I think.
Yep.
I think it's skate, I think they used to call them skate monitors, rangers, whatever. There's a name for those guys. Anyway, yep, okay, so I think I got it. Christine, you're lighting up down there. Is there something you want to add?
No, I'm certainly happy to assist with the contact tracing,
Okay.
or,
Yeah.
I can discuss, I can reach out to, I can speak with the manager of the skating or whoever's in charge of it, the rec department, and work with them.
Okay.
If they're going to be doing some type of signage or, a list of people that are, whatever you think is needed. I'm
Okay,
happy
yep,
to
I got
assist with that.
Yeah, thanks.
So, I would say, if you want any further comments, I mean, if you draft anything you want to come to the board, obviously
Okay.
free to run it by us, but you kind of get the idea. I think
Okay.
policy-
All right, so we spent enough time on that. I get a general impression on how we want to move forward with rec. Let's see, some simple issues, if there's any such thing. Yes, we have a list, and we've, as of this week, we've issued applications to renew the license of all the food establishments in town. And so that's on its merry way, and we're already starting to get some results back. And so that's a good thing. The next piece, and I'm hoping to have this, not by our next meeting, certainly by the first of the year, because I was promised that there's a master list divided by 3, and that would mean Laura, Daniel, part-time inspector, John, and I don't know how it's broken up. I'd like to see how that works. 2, and we may have some, I mean, if it ever gets to the point we can talk about things other than COVID, it would be nice to try to save some money and some effort on how we do our food safety inspections. Thanks, by the way, Kerry, for bringing that piece up. It does sort of wrap it up around the importance of what we consume. And so that's pretty good news, I think. We're on
Yes.
top of our application renewal, our permit renewal program.
Right.
And the first of the year, we should have numbers of inspections that are being done. And these are specific things that the board requested, if I'm not mistaken.
Okay, yeah.
Peter, how's it going with the implementation of the electronic system? Is that,
Yep, I was going to talk about that next. And we're discovering a couple glitches, but we're still meeting on a weekly basis. Daniel Bachman is really a natural. Our tech department is
great?
working very closely with him. I sort of sit in and shrug my shoulders most of the time, but an extra set of brain cells, and that's about all I have anymore, is one set. Can be helpful. And so far we have had our, I call it permit sharing software, work to completion over the social permitting. And now we have our dumpsters connected. We found one glitch, but it's most of the way there. So everything is being signed off. When we get permits that are shared by the building inspector, such as if it's a food establishment, for example, and building needs health, that's all being done electronically. So we've really come a long way. And I give full credit really to technology, but at the same time, they have been, to put this gently as I can, they're really responsive. They want help to catch up. And they're like really putting forward a lot of effort to try to get us, to the same level as some of the other divisions and departments. So, we're not going to get there overnight, but we are taking little bites. And I think it's, some of the language you hear, low hanging fruit and the early win victories. We're getting some stuff going.
Right.
That's excellent. Congratulations and thank you. And thank you to everybody. That's great.
That's it. Everybody gets credit for this.
Yeah.
That's great. Good
Um,
to hear.
I think that's all I have tonight. Oh, no, we have to have Kerry chime in for our incident command updates, and then I'll finish with one civic recreational permit issue. It's just a single one, and then we can move on if that's okay. But Kerry?
Yes. Sorry, Rick, do what you want to say something?
I was just going to say that, now that I think Bob distributed the minutes of the incident command from this Monday, if you could just highlight, maybe a few things since we had the opportunity to read through it.
Yep. And I thought this would be a good opportunity too, as Peter and I have discussed, to acknowledge and make sure that the board is all the board are aware that I have a specific role with emergency preparedness planning and activity, that I'm not only participating to represent the board, but also I'm bringing to bear all that work that I've done for the last 18 years. and I'm happy to do it. And I just want to make sure that that's clear with everyone. It's working with Laura, it's working with Peter, it's working with command and with the emergency management folks and Christine. I'm just trying to help the system. So it's kind of a dual use role when I'm at the command meetings. I think for the highlights, I would like to highlight just the availability of the mortgage and rental funds, support funds. That is a program that we discussed at command. It's important. The dollars are only available through the end of the year. And I know that that's happening with support from Reading Savings Bank. Julie, is that right?
Reading Cooperative.
Reading Co-op. Yep.
I
Reading
apologize.
Co-op, yeah.
Reading Co-op, Julie Thurlow and another staff person joined and talked about that and are providing a lot of support. Jean can probably do better justice.
Yeah, we actually are partnering with them, and they're able to work at lightning fast speed, which is not our strong suit. So
right. Right. Government's not supposed to move at lightning fast, right?
we always get in trouble when we go fast. So
Yeah, right.
so it's best to give it to the people that do this stuff all day long. They've done it all along. Their expertise is fantastic. They can make short work of it. And so that worked out great partnering with them.
So there's a way to apply for funds. The funds are available for mortgage and rental assistance. It has to be in the recent past. And I think that the dollars are going away essentially December 30th. So there's some urgency. So if there is anyone who might be able to take advantage of this support, it would behoove them to move fast. So that was a good discussion in command, and it was really nice to see the partnership with Reading Co-op. Sorry, and we did talk a little bit about testing. Just a little bit. We're talking about, is there a way to bring in additional testing resources? That's a continuing conversation. I know emergency management is doing some discussion with a local medical practice. I know that nursing was, starting to talk about whether mobile testing might be available. So, we're continuing to consider it, especially given the increase in cases. And then I'll just say, oh, there's some important continuity of operations planning happening. Because everybody has their continuity of operations plans, 3 deep. If somebody's sick, there are two people deep in the org chart that could cover those roles. But
Okay.
because of the way COVID is impacting folks, there was a need to revisit this, make sure that we have good coverage throughout, and kind of consider how the impact might be different for different kinds of departments that maybe could, so some departments might be able to do A/B teams, and some remote, some in, or stagger hours, and other departments don't have that ability. So that's a really important piece of planning. It's going to continue to be important. That's happening. And then I'll just say, from my own work, I have reached out and made contact with the person who coordinates the Medical Reserve Corps for the region that we're in, to get some information about what exactly those available resources are, kind of how many folks are there, and what kinds of skills do they have, and how do we activate them. I'm familiar with MRCs, just not with this one. And we're doing continuing on an emergency dispensing site planning. I think some staff are going to have a meeting next week with emergency management to review the existing plan, talk about some of the customizations that might need to be made, and feel like we're in good shape on that. We're a little ahead, but we do have a plan, and it can be adjusted, and we're meeting on it. So that's all I had.
Let's see, Christine is still here, but there's been some work on translation services as well. Christine,
Thank you.
would you say something about that, please?
Yeah, so what so in collaboration with the school nurses and the senior nurse advocate, we have done, I would say, a very quick needs assessment for the town. And, some psychological needs in the community have come up. One of them was interpreter services. I was able to contract with an interpreter service that is approved by the Department of Public Health. We now have a contract with them, and how it works is, an invoice. So if we needed interpreter services, we would reach out to them. There's a protocol now, and we would reach out to them for whatever hours they bill for, an invoice, and I can be responsible for that. I can speak with management about it further. I would be responsible for submitting that invoice to the state for reimbursement. It would be covered by from the state. The town would get reimbursed. We had to put it in place rather quickly, again, because of some positive COVID cases and people in the community that really needed some psychological and some assistance monetarily, whether that be through the food bank or the CTC, for if someone was getting evicted, we needed to sort of get them some assistance through the state or connect them with someone that could actually interpret in that language.
So that was a really big jump, and thanks to Christine on that.
Yes, big
Yeah,
save.
good job.
Yes,
Yeah, no,
well done.
It really is. That happened in like a week or less. And then, if it's okay, we'll just wrap up with civic recreation permit issues. And here I go again. I'll try to keep it civil as I possibly, but this was the hot button when I got here. We didn't know who was supposed to be checking in and how it was going to be done. It's been simplified so immensely, both through technology and just by user-friendly methods. And the example I will give is I speak to these people that want the permit. So we go through all the checking off the boxes, and that doesn't mean that much to me. They can say whatever they want with a check mark. Until I have an interview with them and build a rapport around some of the basic and the fundamental practices that you must have in place in order to be successful in not passing the virus around, really gets us a lot further than the paperwork does. And the most recent one was as an example, they want to use the campfire at the town forest, and it's going to rain on Saturday. So the applicant said, can we move it till to Sunday? And I was able to, after I had spoken with her earlier in the week, single word, sure. And it was done. So now they've moved from Saturday to Sunday, and that's kind of the way, and everybody knows about the keep it simple piece. I think when we were Boy Scouts, it was keep it simple, stupid. It was the KISS effect. I don't know how we call each other stupid, but it is simplified. My only concern now here, as I wrap up my portion of the update, is that Christine's role is getting more complex. The folks that are dealing with the questions and the brighter we think we're getting, the more information we're digesting, the more questions keep coming up, and we don't have answers to questions. Somebody's not going to like it, but we don't know anything about virus as far as I'm concerned. And 100 years from now, people will scratch their heads and say, the poor guys, they struggled over this thing they thought was a virus. So we have to help her keep it simple.
Yep.
Some of the other things I think we're moving really well in simplifying the processes here at Town Hall with the rest of the programs in the Health Division. Thank you.
Great.
Thank you.
Thank you, Christine.
You're welcome.
Right, budget, Jean. So we talked last time about what we thought were
Frozen up, Gina.
No, I think I'm okay.
to put in the budget for the 2022 budget, which starts in July of next year. And I think, Jean, you were going to kind of show where the draft is at this point.
Yeah, I can, if it's helpful, I can start with the FY21 budget, which is the budget year that we're in. Because I know that budget, town meeting approved that budget a little bit later. So FY21 starts July 1st of 2020 and ends June 30th, 2021. So it's always the end date that we use for that fiscal year. So we're in FY21 now, and we go into FY22 July 1st of 2021. And so I can just pull that up real quick just to as a backdrop of kind of where we're at now and what the baseline is, and show you what that looks like. Just make sure I grab this the right one. Okay. So this is what the current FY21 budget is. And the health agent, obviously, the health director, that's the 50,000 that was added at subsequent town meeting. And so we put that in under the health director line item, and that's what we're paying Peter out of. The health nurse, which was funded initially at 20,000 and change, that's been increased, and we've pulled from some additional funds also that were over time. You can see the 20,000 here was moved up into the nursing line item. So so there now remains 10,000 in the overtime, which we haven't used any, as you can see. So that kind of just sits there. But that's basically the current year budget, and this gives us the ability now to have Peter on board and to have Christine Harris at 24 hours a week. We are also looking at having another, as you know, we advertised over the summer for another part-time nurse. And so we're getting very close to hiring that part-time nurse. We've interviewed, and I don't want to jinx it, but we're getting close. So should we need to go into this overtime line item to pay for the part-time nurse, I think we certainly have the ability to do that. And I have other parts of the budget that I can go to that I have vacant positions. So there's no problem with salary money.
Right.
Okay.
Great.
Paula, did you have a question?
Yeah, just remind me how many hours that part-time nurse is going to have.
So we right now we're thinking 10 hours a week. We haven't quite settled on it.
Okay.
I'm not really sure, if there's more availability of hours, we love it. But for starters, I think we're going to try with 10 hours. My sense is that that could probably increase, but I don't want to scare people away by asking for too much. So trying to walk the fine line here.
Thank you.
Yeah. So that is, and then down here, the expenses, just to make the picture a little more complete. Oh, the one thing I didn't mention was the revolving fund support. So this negative 2,100 is what we've gotten from the revolving fund, and the negative 15,000 is the infusion of funds from the grant. So as I say, there's more opportunity to have funds available for the nurse there as well. That's the MAPC 15,000 that we were given, I guess, last spring. And so we're going to be closing out the report in a few weeks and documenting that we've spent that on salaries. And so that money is an infusion into the budget as well. So anytime you see a negative, it's a positive, which doesn't sound right, but that's how accountants work. And again, having that infusion into the budget is helpful. And if there's time tonight, it might be helpful. We can put it on the next agenda or whatever the board wants to do. It would be nice to have a vote to go along with that 2,100 and what we call support, but I'll leave that to the board to decide. And so then expenses are separate, and you can't commingle salaries and expenses in municipal budgets. So if I'm showing a surplus in expenses or a surplus in salaries, I can't just say, oh, great, I have, extra funds. They have to sit in separate places and be spent and encumbered separately. So it's a small budget, but the big piece here was this 20,000 that was also provided at subsequent town meeting. It was the 50,000 and the 20,000 for expenses, and that was really dedicated to the study that we've been talking about. The good news with that, even though we kind of put a pin in the study until after the first of the year, is that money, we have until June 30th to spend it, but we also have the ability, if we get close to coming up with a plan, we have the ability to encumber it and carry it over into the next fiscal year. So there's no need to worry that we're going to miss that if we don't get it done. We can figure out a way to make that work, and June 30th isn't hard and fast. And the other line items are just small line items that we use. The animal disposal line item we use for some rodent control measures that we have in place through a company, and we work with the state on health weights and measures and mosquito controllers through the state. So they're really very small line items, and I think that's supplies and equipment and mileage and that kind of thing. So, so that's this year's budget, and I can let me stop sharing, and I'll pull up I call it the ask budget. So, in full disclosure, the public services budget will go before the select board on December 15th. If anyone's interested, you're more than welcome. We always invite all the boards, committees, and commissions to anything related to the budget. And the select board is the first step in the budget process. And in all my years of doing this, which is a lot of years, I've never asked for a budget this high. I've always stuck with pretty close to a level funded budget. In terms of my ask, this one is not a level funded budget. It's an ask budget that's roughly about 15% higher than FY21. So it's significantly higher based on significant needs.
I'm glad we could be part of your breakout year. That's great.
We'll see how that goes. I may find my future in the fine world of fast food. So that's the case. It's been a blast. Let's see where the next year. Of course. Screen share is not cooperating with me. Okay. This is the wrong one.
Hate it when that
Okay.
happens.
Yes. Let me see what I've got here. No, that's the wrong one. I'm sorry.
Okay. Take your time.
Bear with me.
Yep. It never ceases to amaze me, even though I'm on Zoom and Teams all day almost and screen sharing left and right, how unadept we all seem, get with, wait, how does this work?
Well,
Yeah.
I find that when I have PDFs, they really, I have multiple open and they don't like that. Here we go.
Yeah.
Okay.
Yeah.
Okay, here we go. All right. So this is FY22 projection budget, and this is the dream budget.
Yep.
And so in the biggies are right here: health director and health nurse. So the 160 is the 100,000 for a new health director full-time and 60,000 for retaining our interim services. The health nurse goes from 20,000 to 80,000, and that budgets for both of those nurses. Christine at 24, and I think I budgeted the other nurse at was it 19? I think it was 19. Yes, that was 19. So it was a total of 43 hours between the two part-time nurses. And then everything else is kind of a little just a cost of living or whatever. This 30,000 in overtime got reprogrammed at 10,000. The support is 2,100. But here's the big difference right here. So
Yikes.
that's
Yeah, wow.
about 156,000 more.
Yeah.
Yeah. Yep.
And as I say, that's this here.
Right.
Okay. And Jean, if I may, sorry.
Mhm.
So it looks like this budget does not reflect the public health preparedness funds that MEPC is the host agent for. Is that because those are grant funds not received and they don't budget until you have them?
That those grant funds are in the current fiscal year. 15,000. Yep.
Right, and there's not you're not budgeting anticipating them in the next fiscal year because they're not guaranteed or
Right. We're meeting about that now. I don't know what that might look like. So I
Yeah.
had to have my budget in, a couple
yeah,
weeks
no,
ago.
I just want, yeah,
Yeah.
and because actually those dollar amounts don't get set until February if the state gets the notice from the federal government about what the award is timely, then they're able to notice what the awards would be at the local level. So I mean, I've seen that. It's just it doesn't appear as a line item until the dollars are actually going to be
Mhm.
available.
Yep. And then in terms of the expenses, it's pretty flat. I did not ask for another 20,000 for the professional services because I focus mostly up here. But just to let the board know, other parts of the budget, there are funds. There's something in the general admin budget called outsourced professional services. And I did put in extra funds in that line item. And that, that's kind of where we do a lot of the studies and whatnot. And so that's one resource. And I also budgeted for COVID-19 expenses. And those two things, I think I put in, for COVID expenses, 20, well, let's see. Put in, so outsourced professional services, I requested 45,000 extra for a total of 50,000. And the COVID expenses, I put in, I requested 20,000. So those are a couple of big numbers that are in the general part of the budget.
Can you, can you just clarify the outsourced expenses? What is that for additional inspection? For consultant? What is that?
Consultant services. So let's say that, the board decided at some point that 20,000 really needed to be, I don't know, I'll say 25,000. There's some flexibility in the budget
Okay.
to
Okay.
to move some funding around to secure that. So the other option would be if the board decides in February that whatever the number needs to be for the study, we could go back to town meeting and ask for money at annual town meeting. That's pretty tight time frame, so you would need to know. I think the town meeting warrant for annual town meeting closes sometime in February. So that's. But both annual town meeting and subsequent town meeting, we often go back and make budget adjustments. We always do. So this budget anticipates what we can anticipate right now. But as things change, we can go back and request funds as needed.
So if there was a significant need, it's not like you just have to wait until
Right.
fiscal year 2023.
Right.
Thank you.
Yep.
So I think this represents a full-time health director and the additional roughly half-time nurse. So we have about 1 FTE of public health nursing, which I think were the main areas that were discussed at the last meeting. And Jean, at what point, so is it at the finance committee that, I know that that's where the final decisions are made, but could we expect the select board on December 15th to say, come back with something less? I mean, could there be pushback at that point, or is it at the finance committee?
Yeah, so it's funny. I've seen it go so many different ways. I had one time at the select board, they added a position. So that took me really by surprise. So they'll weigh in and give their feedback, and then it's up to the town manager to present a balanced budget. And the finance committee is involved in that as well. But he has to submit to the finance committee a budget that he can support. And then the finance committee meets usually every Wednesday in March and goes over the budgets and votes.
Right. Okay.
And then town meetings in April.
Right. I don't know. Any other comments, questions? Josh, it sounds like we'll see what happens at this point.
Did you want to do the vote on the 2,100 for support out of the revolving fund, or do you feel more comfortable doing that another time?
So the 2,100 is the revenue we get for some activities in the health department. Is that for like permit fees and those kinds of things?
The revolving fund is mostly funds that are generated by mostly the clinics, the flu clinics, because
Okay.
that's a revenue generator. So as we generate because we get reimbursed and all that, then we are able to show an increase in revenue, and that sits in its own fund, so it's not tied to the annual budget process. It's its own revolving fund. We buy things out of it, money goes into it, and its own little, almost like it's not quite an enterprise fund, but along those lines.
Okay. So what would a vote be to approve?
So the vote would be to have the Board of Health authorize 2,100 out of the revolving fund, because the revolving fund is under the care and control of the Board of Health. You recall we did that with the postcard this summer.
Yep.
When we were spending money out of that. It's not essential. I think as a rule, it's not practical to have the Board of Health vote every time a reimbursement comes in, or you don't want to spend your time on that. But I think it would be a nice thing to more formalize things that like this, of support going into the budget, and the bigger activities coming out of the revolving fund, like the postcard program. I think it would be a nice thing to have as a protocol to have the board vote it.
So can we have a motion to approve the 2,100 from the revolving fund, recommending for the 2022 budget?
I'm sorry, can I ask for a point of clarification? I maybe I was writing things down and I missed it. What is the 2,100? We're approving to transfer 2,100 out of the revolving fund to pay for services?
What we call, it basically is a contribution to the annual budget from this revolving fund.
Okay.
And we call it support.
Okay.
So a lot of the different pieces of the budget have support line items. It's like when a grant comes in or whatever.
Yep.
So it's just to make it a more formalized process, having the board vote it, I think would be a nice thing to have.
Okay. Okay. So a motion to transfer $2,100 from the Board of Health revolving fund to the general fund for the 2022 budget.
Second. Paula. Roll call, Paula.
Yes, please.
Carrie.
Yes.
Rick, aye. Okay.
Thank you.
All right. A couple more items. So public comment. I had sent a memo, actually, we were going to try to get it last time, but we didn't get to it. I sent a memo with my thoughts on how we might structure the public comment section to be more analogous to what the select board does. I think that it's important, obviously, the public can participate in this meeting in terms of listening in, and they should be able to ask a question or raise an issue if they want to. But it seems like it would be more efficient if, like with the select board, they would email, in this case, Peter, in advance, and with the fact that they would want to address the board for a couple minutes and what their question was, and that would both help us at the meeting to be quicker or more efficient in terms of going right to that person and asking them to raise their concerns. Would also give Peter or whoever a time to make sure we have the right answer and the right information for that individual, as opposed to just sort of bringing it up off the cuff during the meeting where we may not be ready. So my proposal would be to really take the verbiage that the select board has when they put up their agenda, and say, it's open to the public. Pretty much what I had in italics, I think, from in that memo was directly from the select board posting, and that someone, could participate. They would have 2 minutes. They should email Peter by such and such a time before the meeting with their question or concern, so that gives us all a heads up. And then at the meeting, we call on the individual and allow them to speak. I mean, in all the meetings I've been since the end of July, I think it's a rare thing that anybody really signs in and wants to raise an issue directly. But so people feel comfortable with that, or
It's worked well for the select board to date, yes?
I believe so. I mean,
Yeah.
I don't sign into all the select board meetings, so.
I understand the reasons for it. I also want to say, and I certainly can support it, but I do also want to say that for me, I did have kind of a strong reaction to it initially, because I feel strongly about the ability of people to ask questions, to pose questions of the folks that are serving them, and I'm always concerned about restricting flow of information, and are we doing so appropriately? So I do acknowledge that I first like, wait, what are we doing? What, but I think that the way that it is constructed with, providing the parameters, I think that generally that works. And I'll support it in the interest of making sure that we're able to provide good and accurate information to folks, and knowing that they can reach out in other ways at any other time.
Right, that's true.
Yeah.
Thank you.
Yeah, I would just add to Carrie's sentiment. I wouldn't restrict people from just calling in last minute and asking a question off the cuff as well. I think that's something that we absolutely should be allowing. I think this is a nice avenue, certainly, to get the information into their hands at the meeting, which is great, because a lot of times you ask the question that you have to then go run down the answer to and get back to the person. So I think that certainly is a nice venue for that. But I wouldn't restrict people from not just popping into the meeting, and that has a concern.
Right.
Because it is a public meeting. It's their,
Right.
we're their board, essentially.
Right.
So
And I think,
Good.
I was just gonna say, you just made me think of, so if we were in someday, we will actually be in the same room meeting together again. And and if a member of the public, appeared, we certainly wouldn't say, I'm sorry, you're gonna have to leave, right? We would welcome that. So it's kind of analogous. So that I think that makes good sense. Sorry to interrupt, Rick.
I mean, we could have easily both avenues. I mean, we can post this, and so there might be some people who will say, gee, I want to raise an issue with the Board of Health, and they'll go online and they'll see it, and they'll email Peter, and they'll kind of go to that avenue. And then there will be this, we can always, at the public comment section of the agenda, just if there are people from the public, say, are there any comments for people who may not have gone on the website and gone through this process? I mean, we can be flexible.
Right.
Presumably, if you have a process out there, it's more likely people who are interested would do it. There doesn't seem to be really heavily controversial issues like cell towers and stuff that come to this board, so I'm not too worried.
A lot different when you're elected as opposed to appointed.
Yes.
Yes.
Okay, so we'll do that. We'll post it this way, but we'll continue to, if there are people who tune into the meeting, we'll give them an opportunity, or we'll just open it up if they have a question.
Yep.
Okay.
Sounds good.
Do we need to take a vote on this?
I don't think so.
No.
I mean,
No?
if you wanted to, you could. I think this is more just a procedural,
Yeah.
how you're handling something. I think it literally can just come from Rick as the chair.
Okay.
This is how we're gonna do it moving forward. Yeah.
Like it.
Okay, data elements for monthly health division staff report. All right, so let me just give a little context for this piece. I think that and things are improving, but I think that what I have sensed in talking to previous chairs and kind of sitting in the meetings and so forth prior to Peter's arrival in particular, but I've sensed that there's been frustration about the board members really knowing how things are going, not just around COVID, but really all the responsibilities of the health department. And the monthly report that is provided previously by the health agent, now by the health director, is the opportunity for the board members to hear, what exactly has been going on, so that we can feel that, the health promotion and prevention that is our mission is actually going on. And in the absence of that, I think we've had a tendency to sort of get into things that we don't necessarily need to get into, as long as we know that there's transparency and we know what's going on. And so in order to be able to do that, I think we need to structure the monthly health director report or health staff report in a way that has the relevant information and that flags any concerns that might come up, that might have come up in the past month, so that we can ask questions about it. I was sent, it was interesting, I was sent several monthly reports from the past year or two over time. And I looked at in other cities and towns, and it's all very variable, and it's all sort of person dependent. And it doesn't always give, as much detail, because if a report has the detail, then we don't have to ask it during the meeting. And so I put together a list of data elements that seem to be reasonable. Peter has processed it with the staff and made revisions to the document. And the one that got sent out Tuesday was the sort of the latest version. And basically, it lists in three broad categories, and I'm thinking there may be a fourth. What is the information that the board should see? And so the idea here is, for this part of our agenda, is for us to look at that list of elements and see if there are things that board members would want to see in addition on a monthly basis, or things that maybe you don't feel you want to see. One of the things that Peter's staff or Peter did was to chunk it out in terms of epidemiology, which is more the infections and so forth, environmental, which is more the food inspections and all the various inspections that go on, and the third being emergency preparedness, which is the emergency planning that is happening in concert with the state and regional entities. I think there might be a fourth, which is listed under other, but maybe that other should be, community health, promotion, and prevention. And I'm thinking that if we get to a place at some point where the board, I'll just pick something simple, the board decides that based on a community needs assessment, that the incidence of hypertension in the Reading community is really high, and we want to do high blood pressure screenings, that would go under a fourth category of community health promotion and prevention. There could, and lots of other things could fit in that, like we've talked about mental health, and there could be other health promotion things we do. And so the idea would be to that the report that we would get in our pre-board packet starting sometime hopefully in January or February would have the data that's listed in this sort of draft proposal, case counts and school-related cases, and the MAVEN data, and detail about vaccination programs. And then under the environmental would be, how are the inspections going? Are we up to date? What cases had a second or third, needed a second or third inspection, which suggests that there's a problem. Maybe we want to ask about those, or complaints. I think this came up a few meetings ago where there were 47 complaints. And it's like, 47 complaints about what? And so you kind of really want to see, well, there were 10 about food establishments and 4 of them were a particular food establishment. Well, tell us about it. That's kind of what we want to know. We don't need to know the results of every routine inspection. We just need to know the hotspots.
Yes.
And the other point about this is that besides food, there is a whole list of other things that, I'm learning public health. They don't teach a whole lot of public health in medical school,
They do not.
But all this other stuff that the health department does around animal and housing and indoor quality and drinking water and waste disposal and all this stuff, we would get some reports as relevant, mainly around inspections done, problem areas, complaints. The only other thing I put down at the very end, which I've kind of always felt was not very value added, was I don't need to know that vacations were approved or the payroll was done, or certain I met for 2 hours with so and so, because this is part and parcel of the job and minimal administrative tasks, so those would not be included. So I guess the question, first of all, Peter, if you have any comments about this kind of approach, and hopefully with the department becoming more automated about all this stuff, the data we could get from that automation will supply this information very easily. But first, Peter, if you have any comments about this approach or things you'd add, and then we'll open it up to any discussion.
I mean, this is a pretty typical approach. It's a little more comprehensive than what I'm used to, but I'm happy to do anything. I mean,
can I also make a comment here when you're done? I'm sorry, it's Christine.
Yeah, go ahead, Christine. Say.
I'm sorry, I didn't mean to interrupt.
Right.
I do agree. I think you had mentioned a fourth point in that, there is an importance for a needs assessment in the town, and for that information to be relayed, because there is going to be some sequelae that follows COVID, and some health needs, whether they be mental health. There are also other public health issues that have been brought to my attention, like you just mentioned, hypertension. I can list several other public health needs, and I'm certainly happy to incorporate that in my reporting.
That's great.
I was starting to say, though, with the automation piece, it might, let's see, the automation might bring us back to where we were in the first place with lots of trivial information. So, my style has been, and I mentioned it earlier tonight, some interpersonal skills, try to keep this interesting. Let the director and his staff decide what's best within this comprehensive template, that the board could assist on. We talked about the ice skating rink tonight. I think that was a good chunk of information. That was really a good exercise. But to go through every single, and even if we start to get in the automated part and find out what's going on with indoor air quality, and what's that got to do with pest control, the cockroaches associated with asthma rates, is that indoor? And you can really get tied up in knots, tiny little knots for that matter. So that part I'd be a little bit leery about. And if it makes sense, and you guys can decide, but if it makes sense, just let a skilled director decide what major item they want to tackle for the month at hand. You know, then if it starts to snowball, we did this with tobacco control. We want to reduce the exposure to indoor secondhand smoke, environmental tobacco smoke, or do we want to work on getting tobacco away out of kids' hands by? And so there'd be big picture items that we could kind of fine tune on. Tanning was another example. And you know, a lot of times grants will drive the needs assessments. People are out there already saying, you know, skin cancer is on the rise everywhere. If we could do something about these non-tanning beds in the communities, so that would be a topic we would want to totally focus on rather than go through all the data that's surrounding drinking water, indoor skating rinks, pests, odors, all that sort of stuff. And
You know, I
keep it alive.
Yeah, no, and I want to clarify before we open this up that this is not that we would walk through all the information. You know, we wouldn't walk through, oh, you did, you know, 27 food inspections. You know, tell us about each one. The purpose of it is not really, the purpose is that, and I'll just give an example. You know, the purpose is that, and I'll stay with the food inspection thing. My understanding is that we have 130 odd establishments.
Sure, yep.
They need to be done twice a year, inspected twice a year. You know, if there were a problem of a significant nature in one of those food establishments that resulted in, you know, a major outbreak of some infectious disease, and it became apparent that really there should have been, you know, 130 establishments, there should have been 260 inspections in the past year, and really there were only 120, you know, and that became apparent that this particular establishment wasn't done. If the board had not been following, not the specifics, but the aggregate data of that, you know, the work is being done, then we're not really doing our job. And where I worked, there was always something called the Boston Globe sniff test, where, you know, what would this look like if it was the headline by Boston Globe? You know, outbreak of salmonella sickens 200 people in Reading, and the spotlight team shows that, you know, the inspections weren't being done. Well, you know, then the board is kind of asleep at the switch. So again, I absolutely agree with you. We don't want to get into the detail, but we just want to see the data, the numbers, which should come off this automation, hopefully over time.
Yep.
You know, and kind of go from there. You just want to feel like it's being done. I don't want to discuss every little inspection and complaint.
I get it.
Carrie?
Thank you. Thank you, Rick, for the work you did in assembling this. Thank you, Peter, for working with staff and kind of fine tuning it. I love this. Well, I mean, this is what I'm accustomed to seeing. And to Rick's point, I think that what this does is that it allows the board to demonstrate that they're doing their due diligence. And that's something that's an important tool. I see this as it's a data tool. It's something that would be provided in the packet in advance, something that I would read. I don't intend that, I would be querying, and I would expect that the qualitative data would be the things that the director would be bringing to us. And there would probably be apparent from the data, but there would be other things that wouldn't be apparent from the data, but that you would know, Peter, or staff would know, and would be saying, we're starting to see this coming. So I'm more interested in the qualitative aspect, and the like. I am not interested in going through each column. I love to know, this is how many licenses we issued. This is where we are and how many we've inspected. We're on pace, we're off pace, we're those kinds of things. I have two thoughts on it. One would be, I would love it if this, and if it's automated, it should be easy, if this could provide cumulative information so that we could see monthly, just sort of what and we'd look and see what December was, what, I don't know, if we started in October, then you'd get a report, it would have the October column, the November column, and the December column, or that is more useful to me than just a snapshot. So that would be a request I would have. And then I just have one small thing that I'd love to add on the emergency preparedness piece, which would be, it's more being specific, specifying on the updates. I'd like to include data about what the GPH deliverables are for the year and what the status is on them, because I think that that's a very important piece for the board members to all know. And it would help folks in feeling confident on what's happening, that there is activity happening and that we're on top of things.
Yep.
Thank you for the work.
Yes.
And definitely,
Both
only
of them.
stories. Sorry, Paula.
No, I was just thanking them for their efforts as well.
Any other comments, Kevin or Jerry?
So Rick, you envision this being part of our packet?
Yes, not that
Okay.
we're going to review in detail at the meeting. It's really more background information. I mean, if you had a question at the monthly, this would be monthly, the monthly report by Peter,
Sure.
then you could raise it. But otherwise, yeah, it would be in the packet.
Okay. The only thing I would say, and this is something that we've hesitated on as a board in the past, when it comes to food and complaints, putting down names of establishments, it has always been something we've been hesitant to do, only from the standpoint of complaints sometimes are not factual. We get that a lot from the inspectors, and so it's putting out there a business that now somebody has made a complaint about that was not factual, and it's tough to prove either way that it is or isn't factual. Most of the complaints that they get. So that's the only hesitation I would have. Is it's great to have the complaints received, and certainly we've always said in the past, if there is a legitimate complaints that are continuing to happen, then hey, fair game. That's your own fault. If we're working with you and you're not satisfying the response to those complaints, then I'm sorry, but yeah, you're going to be talked about in a public meeting. But that's the only thing I would say. I would hesitate to name businesses. I'd rather see what the complaints are and what the resolution was to that complaint, more than just putting a name to each specific one. So that's the only comment I would make on this, just from what we've done typically in the past as a board.
So let me just clarify. So we might we might ask that the number of, let's say with food, the number of food establishment complaints for the past month, we might have that number. We might ask, and then we would have an expectation that if there was a particular establishment where there were serious and multiple, what the health director felt was serious, we could have that discussion at this meeting with the establishment named. But otherwise, for many of the things that are just, resolved, we wouldn't, that's what you're saying, right?
Yeah, exactly. This is more just a case of, you want to make sure that the complaint is a legitimate complaint, right? And then B, the more important thing, if it is, what's the follow-up that has gone on from the health department, and how responsive is that establishment?
Yep.
Those to me are the most important parts of it. And again, if you're working with Peter and our inspectors, and it's not getting resolved, okay, it's then it's definitely going to come up before the board and should.
Yeah.
Can I offer, this is a typical protocol and it's in line with the code, that if we have repeat violations, they're called in for a hearing. We would make an order to correct, and if that wasn't adhered to, then they would receive a demand to come in before the board and explain why we should continue permitting them.
Yep.
Right.
And we can even suspend their permit until they come in to the board. And that's not unheard of at all. So there's not going to be anybody talking about things behind people's backs. When it gets to the point that they, repeat violations, they themselves come before the board and they speak for themselves.
Mhm.
But to Kevin's concerns, and they're totally legitimate, you can have people complaining about neighborhoods and about a particular piece of property, and that's can get pretty, that can get touchy. So-and-so lives at such and such an address, and you just don't, it can get bad.
But
Yes.
and the one plug I will give to all of our food establishments out there in Reading, they have worked with the health department on a very phenomenal relationship back and forth. We have excellent ownership in this town of our food establishments, and they look to seek out from us even, and from you, Peter. I don't know if you've seen that yet, but look out for resources to make sure that they're doing what they should be doing. So the 3.5 years that I've been on this board, we've never had one business have to come before us for any reason. I'm not saying there hasn't been multiple violations of things, but they always get corrected, and they're usually a violation by accident, not by deliberate action. So we have some excellent vendors in this town, I will say that.
Yep.
Good.
Yep. Yeah, I agree with Kevin's concerns about, certainly we wouldn't want to, complaints may be founded or not, and that's it. That's not the place where we're going to have documentation. I think we're all in agreement with that. And that's not the intent. That's not our interest, but it is an interest to know, to be able to know.
Yeah.
As to know if there are repeat issues, and also as Rick said, to know when you have 47 complaints, well, about what, and and how'd you handle them? It doesn't have to be a long discussion, but how were they handled? What's happening?
Yep.
And Peter, I definitely appreciate that, how much time could go into something like this, and not to add on to it, but I will second Kerry's thought, where month over month, right in front of you is a nice little data point to look at. So I don't know if that's going to be easy for you. I don't want to make it more difficult, but if that's something you could implement, that did sound like a great idea, Kerry.
Thanks.
Well, it's going to be reinventing a lot of systems that's there, but we can do it. And I think it is helpful. And you'll see trends, different seasons of the year, pest controls.
Exactly.
It's October through November, you start to see, rodent sightings, and phone is ringing off the hook, and the mosquitoes come in. And so yeah, that's important to know. This whole thing is cyclical.
Yep. Very cyclical. And then when things appear out of the ordinary, we'll know, we'll be able to help you because we'll know better. So that's what I think.
I would say, Jean, a lot of this could be done through administrative assistance. An organized administrative assistant could, sort of collect the information if it's not automated, and have it available. It shouldn't necessarily, be the Christine or even Laura. They need to provide the information, but someone to organize it could be done at the administrative system level.
Mm-hmm.
So
They
what
even make software right now that plugs in automatically. We don't have it yet, but goes beyond the typical Excel spreadsheet. They make it particular just for health departments. So you have categories like the ones you see here in front of you. I have 13 from animal to solid waste. And it just plug right into it. And you could, it starts to populate itself. We'll get to work on it.
Yep.
Not next month, it's not going to happen. By spring, it will.
Okay, sounds good.
That's good.
Sounds like a plan.
Very fair.
So, okay, so the additional points are cumulative data, month-over-month data. For complaints, really just the number, and only if there's a major problem that hasn't been resolved, DPH deliverables and status of those, and making the fourth section, the community health promotion and prevention, a report back on any programs that are being done. So those are the changes to that. Okay. In terms of our next meeting, one, I think we should be in the middle of the post-Thanksgiving surge upon surge, as they say. So it'll be interesting to hear about that. We'll be able to have some information about the budget, the select boards, how they responded to the budget on December 15th. I think that Peter and I are going to be talking to, and I'm blanking on the folks from what used to be called RCASA and are now
Right.
Prevention and Support. And, it occurred to me that Bob has brought this up a couple times, and that there are other parts of the town that are doing health-related activities. And I know, Kevin, you have been involved on the advisory committee, at least I saw your name there on the website.
Yeah.
But I may be the only one who really doesn't understand what this entity does. And I was thinking if I wasn't the only one, I'm not, okay, I see some nodding, okay, good. Then we might have, I think it's Erica,
McNamara.
McNamara.
Yep.
maybe come at our next meeting and maybe do a little presentation on where the program is now, and that would be kind of interesting. So those are probably the three things: budget, RCASA, and where we are with the post-Thanksgiving expected surge. And we may also have some information by then actually about COVID vaccinations.
Yeah, some preliminary
Hopefully.
for that tier 1 group. Yeah.
Yep, we
Hopefully.
should
Yeah.
that'll be good.
Yeah.
Okay, anything else? I just have to ask Jerry one thing. I see you're sitting in this thing that I'm looking at it this entire meeting, and are you on like a swing inside your house?
Yeah, so I know it's my daughters, yes. So I have stairs to get away from them. So this is it is fun.
It looks therapeutic.
She's 15, so you got to try to make their lives interesting.
Yes.
There you go.
Good luck with that.
I know. I need it. Thank you.
All right, anything else? No. Have a motion to adjourn?
I would certainly make that motion.
Seconded.
Roll call, Paula,
Yes, please.
Gary,
Yes.
Rick, aye. Bye, everybody.
Great
Good night.
meeting, folks. Thank you.
Thanks,
Thanks
everyone.
again.
Thank you, Christine.
Good night.
Well,
Thank you.